So, hey, we are here to talk about being injured and the process of actually going from being injured to rehab and getting back up to par for your sports. So, generally speaking, when you're in a doctor's office, our primary purpose and main job for you is to diagnose the injury correctly, to give an appropriate timeline and treatment plan for you, to implement that treatment plan over that specified period of time. Sometimes the times may vary a bit, maybe a little shorter, sometimes it may be a little bit longer, but we give a general time frame with the treatment plan. That treatment plan can be anything from no weight bearing to partial weight bearing restrictions, as well as going to physical therapy, as well as doing things like massage therapy, and even implementing some more Eastern medicine in terms of acupressure, acupuncture, and things like that, as well as dry needling. I'm a big fan of that. But nonetheless, we implement a treatment plan with you, the athlete, and if you're a minor, then with you as well as your parents. And it's a continuous plan that happens in the office setting as well as outside of the office setting, and it requires quite a bit of correspondence, especially for athletes. With that being said, once you are recovered from your injury, there's a transition time frame as well as a transition intensity time frame that you must go through before you are fully up to par to get ready for your sport. So when you're in the office with us and we say that you may be healed from your fracture, or you may be healed from your plantar fasciitis, or healed from your Achilles tendonitis, or healed from your turf toe, some of the more common injuries, especially in the lower extremity, we don't necessarily mean that you are 100% ready to go and engage in that sport at full throttle. We're telling you that from a clinical standpoint, you are ready to engage, but at limited amounts and at limited time frames as well. So it's quite a bit of a balancing act that a lot of athletes, as well as sometimes parents, may get confused about, which is you are healed from an office or clinical standpoint versus being ready for athletics. So whatever that transition time frame is, sometimes it may just be a couple days to a week, or you have already started that transition in the process of healing. And sometimes it may be another month or two after you've actually healed, because you may have had some muscle atrophy, the neuromuscular stress load isn't quite where it needs to be, or should I say the neuromuscular activation isn't quite where it needs to be. The strength isn't there. Your cardiovascular system may have taken a hit while you were on break, things of that nature. So the other systems of the body, musculoskeletal, cardiovascular system, the nervous system, your brain for that matter, psychologically, they all have to develop and mature during the transition phase to get you back up to sport ready level of fitness. And so it's very important that we recognize this transition time frame, because this is where a lot of athletes re-injure themselves. Either they re-injure themselves or they psychologically damage themselves because they're not quite ready to go out onto the field or onto the basketball court or onto the track or turf and perform. And because of that, they're going to do one of a myriad of things. One being they're going to kind of collapse and withdraw a bit because they're not mentally ready, and they may be the type of athlete that doesn't necessarily respond well to not being able to perform up to their normal level. You got the other type of athletes that will continue to push it and push through any type of pain that they may feel, which then may lead to a re-injury. And you have the other type of athlete that just may be a little confused, may just want to give up momentarily, then want to get back into it, then give up. And so they may just go back and forth a bit in terms of what to do. So during this time frame, it is very important that you're talking with your podiatrist, your orthopedist, your physical therapist, sometimes your chiropractor, your massage therapist, your athletic trainer, to properly assess yourself during this transition time frame to know how to get back up to 100% in sport-specific level of readiness. So with that being said, come on into the office. We work with athletes all the time on this in particular, which is athlete rehabilitation regimens and transition timeframes, especially those who've suffered ankle sprains, chronic or acute, Achilles tendonitis, shin splints and stress fractures, heel fractures, and things like that. Turf toe, of course, is one of the biggest ones. You can definitely come on to the office of Foot and Ankle Institute of Maryland. The link is in the bio below, and we can help you with a rehabilitation treatment plan / escalation plan to get you back to your sport and also have you mentally ready for your actual sport. So that's it for now. Hopefully this was helpful. Let me know if you want to learn more educational material about athletics. Take care.